Are GLP-1 medications like semaglutide, tirzepatide safe to use after bariatric surgeries? Guys, let's talk about it. By the way, free tirzepatide and peptide giveaway, so pay attention to the end of the video so I can explain how you guys can win. We just did a giveaway last night on our live. Super excited to help this person out and help them get their free bottle. When it comes to bariatric surgery, and guys, this is not medical advice, you should always be working with your surgeon regarding whatever type of surgery you had, lap band or full-blown bariatric surgery, the sleeve, or there's many different surgeries. But the general consensus between these surgeries is a mechanical restriction of the caloric intake, right? So you are mechanically restricting the caloric intake into a patient, right? That's what we can say is the commonality, with different levels of effectiveness, of course, and different levels of evasiveness too when you cut off the big chunk of the stomach or parts of the duodenum, for example, small intestine. So what they don't do though is they don't address any of the mindset. They don't address that mind component, which is so crazy to me that I still see patients that have very recently, within the last year, gone through, because recommended by their doctors, bariatric surgeries, and they never even tried GLP-1s. So that to me is just insane, because these medications are much less risky than, I'd say, any surgery, in generally speaking, right? Of course, there's contraindications for this medication like there are any. So when we talk about post-surgery though, okay? So again, you gotta work with your surgeon regarding what type of surgery he had and what that outcome looks like. But what's going to happen, and what does happen, and this is evident in the literature, is we see some rapid weight gain, and then we see it slows down, and then we see a stall, a plateau. Well, that makes sense when you understand what a weight loss plateau is, and I talk about that in a ton of other videos. A weight loss plateau happens from a caloric deficit over time. So for me to give a patient a medication that's going to suppress their appetite even more and put them into a greater caloric deficit when they probably are already in a massive caloric deficit doesn't make a lot of sense. And so hopefully you can have this sort of conversation with your surgeon and understand where they're coming from. These medications do more than that. They also improve insulin sensitivity. So there's a lot of variables to consider, but from a general perspective, if we're talking weight loss, it doesn't make sense. You gotta fix the plateau if you wanna continue to get more weight loss. And then afterwards, you gotta prevent it, which we have a ton of other videos too as well. And so guys, if you are in a plateau, I actually have a series that you could purchase right now through TikTok series. It's a great informative video that lays the foundation for you. And of course, we have a ton of other resources, guys. Click my bio link, scroll to the top, click that link there, schedule your consultation. And as far as winning and increasing your chances of winning, you need to get notified when I go live, because essentially what we're doing is a raffle for the people that actually join us when we go live. So turn on your notifications and follow the channel, guys. We'll see you in the next one.